That's fantastic that you're pregnant. Congratulations. We're thrilled for you. And it is now a good time to start thinking about transitioning to your OBGYN. Typically that transition is made somewhere between 8 and 10 weeks of pregnancy. Your infertility doctors will follow you through that first 6 to 8 weeks of pregnancy, make sure everything's looking great, and then send you on to your OBGYN. Your OBGYN really is the best person to take care of you for the remainder of the pregnancy. Any woman who has conceived through in vitro fertilization is considered to have a high-risk pregnancy. That's simply because the data has always shown us that your risk of having gestational hypertension or diabetes is slightly increased over somebody who conceived spontaneously. Deciding on your next medical team is an important decision because obviously you have made a very close bond with your infertility doctors. It's frequently the best idea to go back to the doctor who initially referred you to your infertility doctors. Alternatively, you may want to speak to friends or family in the area and ask them for recommendations for good OBGYNs. Finally, you may want to look at your insurance coverage and see which doctors your insurance recommends you see. What you might expect when you return to your OBGYN for your routine obstetric care will be quite different than what you experienced with your infertility doctors because you've built such a close-knit relationship with us from all of your visits. You can expect to start seeing your OBGYN much less frequently than you've been seeing your infertility specialist, and that's normal. That's actually a good thing. It tells us that your pregnancy is going well. One of your most important visits will happen around 12 weeks when they'll start suggesting screening for any problems of the pregnancy, and so you'll certainly want to have developed a relationship with your OBGYN prior to that. Some of the things you should be concerned about during your pregnancy is just taking good care of yourself, getting plenty of rest, and staying in a physically fit condition. So whatever activities or exercises you did prior to conception, you can maintain those types of exercises. What you'll notice though is that you have much less stamina than you did prior to being pregnant, so just listen to your body, and when it tells you that you've had enough, you need to just back it up a little bit and relax. Also, you want to adhere to the well-known guidelines of pregnancy as far as no tobacco, no alcohol, no raw fish, things like that. Many of our patients who have finally conceived through in vitro fertilization are concerned about the risk of miscarriage once they leave us. The great news is that by the time we refer you back to your OBGYN, we will have already seen the heartbeat on at least 2 occasions on ultrasound, and this tells us that your risk of miscarriage is certainly less than 10% for most patients, and probably even less than 5%. So at the time that we release you to your OBGYN, your prognosis is really excellent. Patients that have gone through IVF, in my experience, make wonderful parents because, of course, this child is so desired and so worked for, and so that child is cherished, and the true miracle of a new baby is fully appreciated by a couple who's gone through in vitro fertilization. You've wished for this for so long, and you truly appreciate the blessing that a child is, that you end up loving that child and being a superb parent.